Hello, good morning, good evening, everybody. My name is Vaidya Ajitkumar Mandlecha. I'm from Minnesota. I would like to welcome you all to GCAR Global Webinar Research Series. GCAR Global Council for Ayurveda Research is an international non-profit organization based off of USA. Our mission is to encourage, educate, and facilitate basic clinical and interdisciplinary research in Ayurveda. Our vision is to promote and establish Ayurveda as an evidence based health science globally. Our website is www.ayurvedaresearchusa.org. Please do consider joining us as a member, which will bring you access to all our resources. No non-profit can operate and succeed without volunteers. So consider joining us as a volunteer and we can place you in variety of projects based on your skills and interest. Once again, our website is www.ayurvedaresearchusa.org. Now, I would like to introduce our eminent speaker today. Namaste. Vaidya Ajitkumar Mandlecha. He is BAMS CPC MPhil. Vaidya Mandlecha graduated with a Bachelor of Ayurvedic Medicine and Surgery BAMS from Pune University in 1995 and further specialized in traditional Keralian massage, and Panchakarma techniques in 1996. In 1997, he received yogic training under the guidance of Satish Brahmachari and Swami Atmabodh, laying a foundation for an integrated approach to health and healing. With a strong commitment to evidence based Ayurveda, he completed MPhil in Panchakarma therapy in 2009 with a research focus on the efficacy of Katibasti using Shirabala Tailam for lower back pain. Currently, Vaidya Ajitkumar Mandlecha practices at clinics in Pune and Vishwanandan Kendra and also travels regularly to Europe to teach through International Academy of Ayurveda and the European Academy of Ayurveda. His practice is deeply rooted in the classical teachings of Charak and Vagbhata, while being informed by contemporary Ayurvedic research and clinical innovations. As a passionate educator, he conducts personalized Ayurveda trainings at Pune Clinic for students from Europe, US, Brazil, and Israel, sharing authentic clinical wisdom through small as well as focused classes. Currently pioneering work in Ayurveda engineering, he is dedicated to integrating objective clinical parameters into Panchakarma protocols, contributing to the evolution of evidence based Ayurveda. Thank you so much, Vaidya Mandlecha, for joining us today. And this is our second session actually. Last time he spoke wonderfully and talked about Katibasti. Today he will be talking about Keralian massage.
Namaste.
Namaste.
Good morning and good evening to everybody. I am very glad that Dr. Asavari Madam has given me this opportunity to give a small presentation on the musculoskeletal disorder with this platform. And this is my second time I'm giving my presentation, so I'm really very thankful for this. So I will go to my subject and presentation. Just a moment. I'm loading the presentation.
Yeah, musculoskeletal diseases have been very, very common. So this will be very
Yes.
beneficial for everybody.
Can you see my presentation
Yes,
on the screen?
yes, absolutely. It's good.
Yeah. So today's my topic is the musculoskeletal disorder. That is the mainly what disorders, especially that I traveled down to the Carillion Ayurveda tradition where I took the knowledge with my teacher, Dr. Srinivasan, with the with Gurukul Parampara, and that has given me a very deep insight for Ayurveda, and that's what I am. My practice is based on this Carillion tradition. So I'm going to share my experience, what I learned, and the successful case stories I'm going to put in front of you. So with my this presentation. See, today the musculoskeletal disorder is a very common, and most of the occupational disorders that we will see from the, if you look at the musculoskeletal disorder from the child, the school going children to the old age person, everybody is having this kind of disorders. So to understand this, like what we say, Vayu Tantra Yantra Dharaha, is this body machine is being operated by our biological energy Vat, and the disharmony in this Vat due to our uh, lifestyle and the repetitive strain, which is causing this kind of muscular disorder, which is a very common phenomena in the today's era. So we just go through that various disorders, what we will see. So what is this our today's modern lifestyle? This I've just shown the pictures over here. Like for long durations, we are working in front of the computer, laptop, PCs, and we are just running around the time, uh, and this time is like a tyrant for us. And this we are just running around the clock, and this rat race is causing this imbalance in this our kinetic energy, this biological energy path. The stress is always positive and negative. The distress, which is causing the musculoskeletal disorders, this is a very common phenomena which we see in our daily routine practice. Yeah, everybody will be surprised why the stress is causing the musculoskeletal disorder. But if you look at the repetitive strain and the mental pressure, that creates a tension in the muscle, and this tension in the muscle, which is causing the adhesion in the muscle, and then underlying nerves are getting pressurized, and then there is a radiating pain in the upper back, in the lower back, in the arms, and in the lower extremity. So that's why stress is a very common factor here to which is causing the this musculoskeletal pain injuries. At the same time, the sports injuries nowadays, people they are doing some cycling, this biking. Then at the same time, they are doing jogging, running, and doing the different sports activities to keep themselves fit. And due to the overstress and that is a lot of injuries are happening to this musculoskeletal area also. So this is the very common musculoskeletal disorder causative factors that what we can see now today's in today's scenario. These are the various kinds of musculoskeletal disorders that what we can see today. There is a neck pain, back pain, then the frozen shoulder, then the different kinds of joint pains like knee joint pain, then epicondylitis, then the carpal tunnel syndrome. So various kind of this Mausagat and Snayugat and Sandhigat Vat, that what we can consider under this musculoskeletal disorder, and on that basis we are going to see the therapies. So if you look at the pathogenesis, means what we call the samprapti, how the disease process goes on in the today's scenario. Like if you consider any kind of a occupational disorder, there is always a repetitive strain. Suppose I am sitting in front of the computer or laptop or desktop, so there is always a repetitive strain is going on, and that strain, especially on the specific musculoskeletal area, and this strain which is getting uh, into that specific muscle joint, tendons, and whatever the this anatomical structures are located in that area, they are getting strained out, and that's why there is a vata aggravation. What we call is like atishramajanya vata prakopa. So there is like a repetitive strenuous injury to this part, and that's why the vata is getting aggravated over there, and that's why this repetitive strain is causing either the debility in that musculoskeletal area, some muscles become weak, and at the same time there are sometimes, if I'm having a sedentary lifestyle, means there is a obstructive phenomena are happening. So in the both ways this kind of a vata vadi pathology is happening over there, whether it is a dhatukshaijanya vata prakopa or there is a obstructive vata prakopa, means strotorodhajanya vata prakopa. So both way it is possible in this way. So, and this aggravated vata is causing the musculoskeletal disorder. So that's why then this disability, means the range of movement is getting restricted, then the daily routine life is getting hampered over there. This is how the disease process goes on. Now today I'm going to share the how the Kerala traditional Ayurveda makes the difference in the therapies. This is very important and to understand, because see, I am from the Maharashtra region, and when I went to Kerala, so that has given a very different view to my practice and to my knowledge, and that has when you are going to treat any kind of musculoskeletal disorder, this kind of a traditional therapies, it really make a big change and big result oriented practice. So I'm just giving you a deep insight on this with the help of some case studies. See, mainly this South Indian Kerala, the South Indian region, this Kerala, which is mainly uh, the Vaidyas in this Kerala tradition, they are giving more emphasis on Ashtanga Hridayam. This is the main Ayurveda text they are using for their references, and at the same time, from the medicinal point of view, they are using Sarvastra Yogam, Arogya Kalpadrumam, this kind of a texts and their textual references they are using in their practice, and the medicines from this Sahasra Yogam is very commonly utilized in the everyday routine practice. Now, if you look at this Kerala traditional therapy, mainly they are focused on the Snehana therapies. They have very specialty oils. At the same time, they are having a very specialty uh, type of technology techniques that they are using for the external therapies and also for the internal therapies. So this is again a big difference. Again, the Svedana therapies, they are having a variety of uh, Swedan therapies are there, make various kind of pottery that I will share again over here, and that means for every different particular situation or state of the disease, we can have different kind of portals or this portali Svedana that we can utilize in our practice. So this is this we can see also, and another very common this thing that what they are having, they are using majorly the bastis. And if you look at this, their traditional expertise, they are having a very good musculoskeletal management. They are having a very good treatment protocols for the skin disorders, even like psoriasis or neurodermatitis. Means such kind of a diseases, they can manage it very well. Even they are having the specialty clinics or for the ophthalmology. At the same time, the Manas Roga, there is a special hospitals are there, which is which is being run only on the basis of Ayurvedic philosophy. So now, if you look at their practice style and this thing, so mainly, as we say that whenever we go for the any kind of a disease treatment, the first week, where if we are going to give the patient or any kind of a panchakarma therapy, so first we are giving the panchana therapy, then the snehana svedana or this panchakarma will be added later on. So same protocol they are following in their tradition. Only the basic difference is with the medicine. See, now I'm giving you some of the when we are talking about the musculoskeletal disorders, and when the people they are having the AMA sign symptoms. So in that medicine selection, they are having a very different kind of medicines they are using for the Amapachana treatment. Because without Ampachana, we can't do the further Panchkarma treatment. Once the Ampachana is done, then we can easily give the Panchkarma therapy so that we can achieve whatever the result we want to do it. So for us, first of all, this is Chitrakali Kashayam. This all everybody knows that Chitrak is one of the very good Ampachana medicine, and this is a very good formula, especially from the even it is in from Sahasrayogam, then the Rasna Shunthadi Kashayam, Gandharva Kashayam, Amavatari Kashayam. These are the various kashayams which has been utilized for this Ama condition. For example, if I take Amavatari Kashayam, this is a very special kashayam which is containing Guduchi, then Dashmur, Punarnava, Kokilaksha. So all kinds of herbs, I mean, uh, uh, in this kashayams are there, which is giving a very good uh, for us primary treatment to overcome this arm from the body. And then at the same time, very commonly medicine used is a Shadadharan Churnam or Shadadharam Gulika. See, during this practice, what I have observed over there, when the patient is undergoing any kind of a panchakarma treatment, the person is always given this Shadadharma. So that during the procedure, there should not be any kind of a break in the therapy. So that Shadadharma is being continuously followed during these practices, so that there should not be again a vata accumulation during our process, so that our further treatment protocol can be easily followed. That's why Shradharam is being very commonly used during this Panchakarma therapy. Okay. Now, what is the speciality with this Keralite mm, Snehan techniques that I will say that hand and the leg both are used in the practice. See, the hand that is called as Udichil or Thalodal, this is a very special massage has been done with the hands where the unique pressure is being applied throughout the stroke. Moderate to maximum pressure can be given during the stroke so that the whatever there is some kind of a block in the system, and also the very important thing that the marma therapy means the all the marmas are being considered while giving the strokes to the patient. Means, like for example, now if I'm having a musculoskeletal pain in the neck or upper back region, like then the Trikadika marma, Ausa marma, Ausa falaka marma, Kakshadhara marma, uh, then Indravasti marma, all these marmas are being utilized during the stroke of the massage. Means they are when we start the massage stroke from the neck to the tip of the finger, so the pressure is unique and all the marmas are being pressed during, so that you are releasing the block, so that the main concept is that if there is any kind of a block at one point, so that's why this radiculopathy is happening. So you are releasing this block and releasing this radiating pain. This is the concept in this. Means the energy which is flowing from the center to the periphery and from periphery to the center, this has been released. So there is a free flow of energy into the body from center to the periphery. This is what is being followed. In the same way, when you want to do a deep tissue massage, so there is a very special and unique massage which has been done in Kerala, that is Tavitti Udichil. Chaviti, this kind of a traditional massage done in the Kalari Payattu. Kalari, this is a special martial art in Kerala. So in this, they need a good flexibility, they need a good muscle tone. So for to achieve this kind of a flexibility and muscle tone, this kind of a massage therapy is being executed for these Kalari players. So in the same way, whenever we want to work on the deep tissues, like for example, gluteal muscles, like piriformis syndrome is there. So where we want to exert a deep pressure, in that case, this kind of massages is helping a lot. So this is a big variety. What is the special again in this? Means this I was talking about this Sneha therapy. What is a very peculiar and speciality in this Kerala tradition? That they are having a very special oil according to the condition of the disease. For example, now when there is a spasticity in the muscle, so that in the spastic muscles we can use a prasaranyadi tailam. Then again the ketaki muladi tailam, chinchadi tailam, uh, and also the panchamla tailam. So these are the amla oils which is helping us to release the spastic nature of the muscle. When there is adhesion of the muscle, there is a muscle is being tight and stiff. To release the stiffness and tightness of the muscle, this kind of special oils, what they are having in their practice, is being utilized in our practice. Then, whenever you want to do the now tonification, whenever you want to release the pain, for example, if there is a acute pain is there, Murivanna is a special oil which is helping in the acute inflammatory condition, so that helps to release the pain. Again, the Prabhanjan Thailam, this is also very good oil to release the pain. So these kind of oils are helping in the pain management, and also there is another oil that is a Karpuradi Thailam, which is being also used for the pain management point of view to release the acute pain. Now, the another part comes is the when there is a strengthening, when you see that there is a debility in the muscles and the in the musculoskeletal area, and you want to strengthen that particular area. So then the strengthening oils like Balashwagandhadi Thailam, Dhanvantar Thailam, such oils they are being utilized to give the strength. Bala Thailam, Kshira Bala Thailam. So they give the strength to the muscle, to the joints, to the nervous tissue. So all this area is being strengthened with kind of combinations of this oil. Sometimes when there is a radiculopathy or nervous pains are involved, so then there is a one special oil like Carpasas tadithylam. Or if there is a frozen shoulder kind of thing, then there is a Perimetariadithylam. So these kind of a specialty oils that we can utilize according to the stage of the disease and the area what is been involved in that. Then the same oils can be utilized internally to release the, for example, when there is a spasticity in the muscle. So we are giving this Maharaja Prasaranyadi Thailam. See, there is a Prasaranyadi. When the Prasarani is a plant which is releasing the spasms in the muscle, so we can give it internally. Now the Hanumantar Avarti, so these kind of avartis they are also utilized in when there is a degenerative changes are there, or even in the fracture cases, in the traumatic injuries, the Gandha Thailam kind of oil that can be utilized for the internal management. So the most important part, and in my practice that I utilize the Potali Svedana. This is my main uh, practice and the main treatment that I'm using in the musculoskeletal treatment. That is a Potali Svedana. So generally, these portals they can be utilized. Like we have seen that this vata aggravation or this biological energy is getting disturbed by two ways, either with the dhatukshay or there is a some kind of obstruction in the system. So these portals we can vary according to this disease condition. So this we will see. So what kind of a Svedana that we are using here when there is a Shamana Chikitsa, means just to pacify the pain, stiffness, and this is we call it as a Shamana Svedana, means the potali which has been applied just for the sign and symptom relief. The Shodhana treatment is if you want to give some kind of a Basti treatment. So during that treatment, the whole body, the Abhyanga along with this potli Svedana is given, then we call it as like a the treatment, allied treatment for the Shodhana point of view. Then Anga Sapeksha, you can do it for the local body part and also you can do it for the whole body part. So Guna Sapeksha, Snigdha Ruksha, then Karma Sapeksha, Apatarpana and Santarpana. So in the both way, these portals they are having. So this is the way where we can differentiate these portals. But now I have differentiated these portals in the two types. One is oil-based potli and one is kashaya-based potli. Oil-based potlis, they are very warm in nature, tikshna, and deep penetrating. Okay. And the kashaya-based potlis, they are samashitoshna. They are not, their hotness or warmth is not that strong because they immediately they cool down. So that's why the comparison between the oil-based potlis and the kashaya-based potlis is that the oil-based potlis are quite warm, good warm, and deep penetrating, while the kashaya-based potlis they are very mild in nature. In Sweden, so now, what kind of portals, Svedanas that in generally it is in practice? We everybody knows about Patra Portali and Churna Portali. The different one special portali what I have seen in this tradition is that is Jambir Portali, and one can utilize this portali in a very easy way. If you look at the content of this Jambir Portali, there is the lemons, then the coconut, and uh, then garlic and shatava. So these are the basic ingredients what we are utilizing in this therapy. If you don't have anything uh, when you are practicing in some places like America or in Philippines or in other than India where you are not easily getting this kind of herbs. So best is to utilize this uh, cumin powder or shatava powder, which is easily available there. So this is are the best vata pacifying herbs that what we can utilize for the Portuguese Veterana. And especially they are fixed in nature and very good to overcome the stiffness, to overcome the pain. So this is a really a great help in this management. Now, if you look at the Kashai based potli, everybody knows about the Shastik potli. But what special other potlis that what I have seen and utilized in my practice, that is what I would like to share is a Tilamasha Pitta Svedana. As we know that the sesame seed and udi means this black gram. hmm, So this they are very good to give the nourishment, and as you know that sesame is warm in nature and the black ground is very good for the muscle nourishment. So whenever we see that there are muscular dystrophy cases are there, sometimes when the patient is coming with the a long cast, the muscle is become atrophic. So in those cases, for the recovery point of view or rehabilitation point of view, these kind of potlis are very useful to strengthen the muscle and to strengthen this musculoskeletal area. Now this is one another Pruthuka Pottali. Pruthuka means the rice flakes. Rice flakes they are dry in nature. These rice flakes they are soaked in the tamarind water and tamarind decoction along with the garlic and this shatava churna. So they are also helping whenever if you see the arm work cases where there is a edema, swelling, pain management is required. So this Pruthaka Potli is one of the very good source to overcome this kind of stage of the disease. So that's why very commonly we are using this Pruthaka Potli Svedana. The last one and a very different one that is a Godhuma Potali. Everybody knows Godhum. Now, as we are preparing this Shashtik Potli in the Balashwagandha Lakshadi decoction, same way the Godhuma, that is the wheat, which is being cooked into this Balashwagandha and milk decoction. Okay. Now, if you look at the properties of the Godhum is Madur sheet, means it is nourishing, Bruhaniya, everything. So, where it is been utilized? So, if you look at the when there is a partial tear of ACL, when there is a little bit instability in the joint is there. Sometimes the people's the neck is shaking. There is like a bath aggravation, company is there. So in whichever stage you want to give the stability to that part, Godum is the very good choice for that, and we can utilize this Godum totally to give the stability to particular part. And as a Vatvadi musculoskeletal disorder, but without Basti we can't do the any other treatments. So this is the most important part of Vata Vyadhi Chikitsa, musculoskeletal disorders. So this was the just a brief. This just I wanted to share about this Kerala traditional background, and now I will share some of the cases that what I have here with me and what I have treated. So we can go one by one. So now my first case I would like to share, which was very interesting for me. This is lumbar canal stenosis case. One lady, she came from Hamburg. Actually, she was originally from India only, but she was working there. And when she came to India, she was having a very severe back pain. She was unable to move. So the basic reason behind her back pain was her she was a lactating mother, and due to this lactating position, she was having a severe back pain. So the main point was here that she was only here for 10 days, and this acute pain management was the very challenging part for us during the treatment. And so first we started with the Patra Potali. As I said, whenever there is a acute spasmodic conditions are there, so the Patra Potali and Jambir Potali, these are the very good combination that we can utilize to release the muscular spasms. You know, this is a very commonly seen factors nowadays in the cervical and the lumbar region, that you see that there is a straightening of spine and due to the paraspinal muscle spasm. And if you want to get rid of from these spasmodic conditions, like see, we are having this now special oils I just discussed, like Prasaranyadi Tailam is there, or Ketaki Muladi Tailam is there, or this Likuch Tailam, Parinatakeriadi Tailam. So such kind of oils, Kottanchukkadi Tailam. So this kind of oil, if we use in a permutations and the combination, that spastic condition we can release in a very easy way. Then in the so first 5 days we did this to release this Srotoroda from this part. So first we did this intense Svedana Padra Potali and Jambir Potali, and next 5 days we did the Shastik Potali with Dhanvantar Tailam and Murivanna. So this is the way how we manage this case, and I would like to share again. Again, Basti was given. Now this is very important because this patient, he was from Germany. So when the patient got rid of from the pain in 5 days, but he was not believing that how it is going to be managed further. So he wanted, okay, whether it will be recurrence or anything. So he said, we how we can come to know that this problem has been resolved. So then he said, okay, we will do a MRI report again. So this was the first MRI before this one. This is the report from the Hamburg. So you can see this
Sorry, no?
lumbar canal stenosis. Hello?
22-23
Hello.
चालेल. हो.
Sorry, I have muted.
Okay. So the lumbar canal stenosis was there. You can see the disc bulge in this region. And so after this 10 days treatment, again when we did this next MRI for the follow, so this disc bulge was resolved. So this was very surprising even for me, that within these 10 days, this this bulge got reduced very well. So this has given a very good evidence, and this has built a good confidence in us that we can also treat this. We call it as like asti majjagatvat. Okay, because the deep tissue rooted pain also been released in 10 days. So that's why this is a good insight even for all Ayurveda people, that we can go up to this level, that we can also treat the radiculopathy and this lumbar canal stenosis kind of cases very well. Okay, now just I would like to share the another case which was also knee injury case. And this is again, I'm showing every case with the evidence, because see, uh, we need to understand and to see that how we can develop our confidence with the help of this kind of evidences what we have collected for us. So, the patient, just a 40-year lady, she came with a complaint of knee joint pain, and there was a swelling in the knee, and
Oh,
so there was a restricted movement in the knee. So that's why this is her MRI report. You can see that there was a high grade partial tear in the anterior cruciate ligament. Okay, and there was a joint effusion also was there. So then what is the line of action we did? Generally, see, we follow the same kind of a protocol. First, do the immobilization, no weight bearing, same process we followed, but with the help of local lepana. See, Marmagulika. Nowadays, this Marmagulika lepa is available in the tube form. So it's readily available. So cotton chukkali churna, then the Marmagulika lepana. So this kind of a mixture that what we have utilized, and uh, this lepa has been applied for 24 hours. Okay, means after bath I'm applying this lepa, and next day morning I'm removing it, again applying it fresh. So like this way we have given this first application for the to reduce this internal joint effusion, to reduce the swelling, and to reduce the inflammation inside. And in this way, that we have uh, helped the body to give the recovery, and uh, that whatever the soft tissue damage was happened over there, will get recovered in a better way. Orally, we had given the Mustadi Marma Kashayam and Gandha Tailam also to give the reconstruction work. In the next week, then we had given the Murivanna oil pack. See, I was talking about this Murivanna oil. The Muri means pain, Enna means oil. This is a special oil for the pain management. Okay, so this oil that what has been utilized here is mainly to reduce the pain. But now what we do, when once we finish the part of Lepana Chikitsa, then we subject the person for the oil pack. So we give the gentle massage with the Murivanna oil, and the pichu of Murivanna oil is been applied around that affected or injured part, and then we apply a bandage around it. And this is also again kept for 24 hours. And in between that, we keep the soaked pichu. Again, once the oil has been absorbed, we again re-soak it with the Murivanna oil, and then again we apply around this affected part. So in this way, that Murvenna remains long term in contact with that particular affected part, so that the inflammatory and reconstructive work can be done with the help of this oil very well. Then I had given them the next step, the Dhanvantar Kashayam, then Ashwagandha Dhanavati. These are again strengthening and to rebuild the tissue in that area, uh, like Agantujvat. It is Agantujvat. Again, to work with the Agantujvat, Dhanvantar Kashayam and Ashwagandha, this is a good choice of drug. And now you can see the result here, that resolving post-traumatic changes that is been seen, and the joint diffusion is also reduced over here. So this is the way, this how we can also treat this kind of a tear in the ACL. I would like to go to the next case, which was a very interesting and very challenging case for me. This was a case during my COVID period. So actually, stand-on tier case. One school teacher in Ratnagiri, means which is quite far from Pune, and then we did the consultation by video calling because during that time traveling was not allowed, and this lady was not willing to undergo operation. So this was like an opportunity for us, and then the opportunity always opens the door for you. So in this way we took this, accepted this challenge, and I said, okay, now let's take this challenge, and how we can resolve this case, we can see that. Okay, she was as a teacher, she was giving some jumping exercise to the student, and she got injured during that time. And this was her report. Okay, there was a near to the complete tear of tendo achilis tendon close to the insertion, and also to the another both two parts, and also there was a joint diffusion and there was a sprain. So again, the same kind of a process we followed. We had given the rest to that part, no weight bearing, immobilization, compression. And again, this Lepan Chikitsa, that what we have utilized, Dharasana and Bajrang Lep, which was available there, and rest of the medicine we have sent it from here. So this was the first 2 weeks treatment that she did it, so that swelling and the this thing got reduced. And then again we went to the Murivenna oil pack for 24 hours. Then the Anvantar and Ashwagandha and Gandha Tailam. This was being utilized same way like in the last treatment, in the last case. So then in between, because see, we don't want it to go blindly. So we advise again, okay, please go and do the again the sonography of the HD tendon. Then you can see after this that there was a still that 75% tear was there, and which was means 20% it got healed, still that 75% was still it was going to heal. Then the same treatment is been continued, and this was the end result, that then the Achilles tendon tear means only 20% it remained at the end. So this is the way, means like that Snayavat Vat or this Agantuj how we can treat with the help of our this kind of therapies. With this conservatory approach we can manage, means this was a really surgical case, but due to this corona period and this thing, which was practically not possible to undergo other thing, so we managed it through the ayurvedic conservatory therapy, like the lepan chikitsa and murivanna oil pack, along with uh, internal medication. Now, next case that what I would like to share is this now cervical dystonia. Cervical dystonia case, that what we have seen here is that the person, he was traveling a lot from Pune to Mumbai every day, and due to his traveling, what we have seen that he got uh, cervical muscle spasm due to this repetitive strain, because we have seen that atishramajanya vata prakopa. So due to this traveling every day, there was a repetitive strain on the neck region, and so the muscles of the neck, they got into spasm. So that's why there was a, so I'm just sharing that what was the modern diagnosis was there, that idiopathic cervical dystonia was there. So now uh, as a line of treatment that we have selected now, the Prasaranyadi Kashayam. These are the particular things that were from according to the disease process point of view. Now, when there is a spastic muscle, we need to release the spasticity. Though the Gandha Prasarani plant is one of the best plant which is given along with the milk. This was the one part. Then the Balatailam, then the Bruhatvat Chintamani, Dhanvantaravarti, these kind of things, and Jambira Potli. You know, now why Jambir Potli again here? Jambir, it is a Jambir is a lemon. Okay, Lemon, it's again Amla Dharma. Amla Dharma, if you see, if you go to the Amla Rasa is having a property to release the spasticity. If you do the Atisevana of Amla, there is a Shaithilya in the muscle. So this is what we can see. So to bring the Shaithilya in the spastic muscles, so that Jambir Potli has been selected for this. And as we have discussed previously, the special oils like Varuni Tailam, Varuni Tailam, Prasaranyadi Tailam, Ketaki Muladi, Chinchadi, means again Amla Dharma oil is being utilized to release this spasticity in the muscle. Okay, again I'm just sharing that what was the diagnosis. There was a spasm of the right sternocleidomastoid muscle, so that he was uh, his neck was only on one side. Even if you try to, because his neck used to remain only on the left side, even if you try to bring back into the center, again it used to go back to the left side. So this was the the severe spastic condition, which is called as a torticollis, and that what he was suffering very severe pain in the neck muscles, along with the that he was having also diplopia. Then he developed a diplopia due to his neck spasm, because he was not able to keep his neck in a straight line position. It was always on the left side. So that's why this diplopic vision, what he was having. So that's why he was unable to walk on the street. So now after the treatment, he could keep his neck straight. He can turn on the right side. He can turn on the left side. So this is the thing, that such kind of extreme cases, it's like even though he took botulinum injections, even that has not helped. But at the end, after this kind of the Patra Potalis Vedana and Jambir Potalis Vedana, we could release his spastic nature in the muscle. It took very hard effort, because I did my treatment by myself, and due to this pressurized massage therapy and this strong Potalis Vedanas, we were able to release this spastic nature in the muscle. Okay, next case is a very interesting case. A young boy was having the impacted kidney stone, and due to this impacted kidney stone, he developed a bilateral renal failure, and then his mother had given him one kidney. And after receiving the after doing this renal transplant, he was on every day 40 milligrams steroid. And this long-term steroid has caused a multiple problem in this young boy. First of all, he developed a bilateral avascular necrosis. Second, he developed a cataract. And third, he developed a diabetes. So these are the, he has received one organ, but this after receiving this organ, he got into this multiple complication. So this was again a big challenging case, that the doctor advised him to do the cataract operation and the hip replacement, but he was not again willing to do this. So that's again this opportunistic way we have looked into this case, and we started the treatment. Main complaint, there was a difficulty in walking, there was a limping, restricted movement, facial edema, diminishing vision. So all this complication which was related to the long-term steroidal therapy. So then we decided to do Panchakarma therapies for this. First, I would like to share his video, that how he was walking. So you can look at his limping gait. He was limping from the both side, and there was a really big restriction in the joint movement. the range of movement was restricted on the both sides, especially more on the right side than left side. So this was his X-ray. You can see the flattening of the uh, head of the femur, especially more on the right side than left side. Okay, now I will not go into details, but what we have done, we have diagnosed this case as like Gambhira Vata Rakta. And with this Gambhira Vata Rakta treatment, we have used the Google Tiktak Gritam. Then in the beginning, first we have used the Shadharanam, and then after that we have started the treatment, uh, especially the Snehana, Svedana, and Basti treatment. Basti was given along with the Gugulatikta Kritam, Palagudichadi. So this has given a very good improvement that we will see also later how now he then walked with this. And very interesting part was that as he was having a diminished vision, in Charaka there was a very one special uh, Trifala Rasana part is given. So I thought, okay, we should do something for his eyes. So I use this Haritaki, Bibitaki, and Amalaki according to the Charaka. That Bibitaki was given before food, Amalaki was given after the food, and Haritaki in Pachaman Avastha. It was very surprising because one of my ophthalmologist, he was doing his follow, and his vision was 6 by 42. After this Trifala Rasayan, it came down to 6 by 12. So slowly he was improving by this Trifala Rasayana. So this was very interesting case in that way. And with the help of this Gugulutikta Kritam and this Patra Potali, and then later on we did the Shastik Potali. So the pain got reduced very well. Now you can see his walk after the treatment here. This was the video recording in my clinic. The previous video was he recorded at his home before the treatment. Okay, so this is the avascular necrosis case that how we manage with the help of this Gugulutikta Kritam and Gambhira Vata Rakta management, what we did. Now the next case I would like to share, this is a very interesting case again. It was a brachial neuritis for one IT professional person, repetitive strain on this upper back region. And he developed the sudden neck pain and he was unable to move his left hand. I will show you how was his movement. So this was the only movement what you can see here. Yeah, he was unable to lift his hand above this. Okay. So again, big challenge for us to release his pain and to increase his range of movement. So again, to increase the range of movement, the Prasaranyadi Tailam, Prasaranyadi Kashayam. So this was the main internal medication that what I use. And in that case, there was due to this long-term neurological condition what it developed into the left arm, all the muscles in the left arm they became atrophic. The muscle atrophy was there, Mausha Shosha was there. So due to that, we have started again with the Dhanvantar Kashayam. Dhanvantar Kashayam, it's a Bala is the main plant in that, and that's why to use this Balya Kashayam, so we have decided to utilize Dhanvantar Kashayam Ashwagandha, and due to the chronicity, Bruhat Chintamani was also used in that case. So first we did external treatment, Prasaranyaditail, Karinatiriaditailam. So Mahamarsha Taila was used also due to this Mausa Shosha. So first we did the Patra Pottali, Jambira Pottali, because we wanted to reduce the spasticity first, and then we wanted to work on the muscular atrophy. So to work on the muscular atrophy, we have used then Tilmash Pindas Vedana, as I just discussed in the beginning, that sesame seeds and the black gram paste, which was utilized in that case. So now we can also see here that the result, how we got it after this. So, but it took 4 weeks to release and to achieve this kind of a range of movement. So, first of all, Patra Pottali, Jambira Pottali, and the specific Amla Dharma oils like Kottanchukkadi, Chinchadi, Parinatakeriyadi. Also, there is another oil from Vaidya Ratnam, that liquid oil is also there, which is having a similar property like Parinatakeriyadi. And these oils, they are really helping to work on this frozen shoulder type of cases where there is a restriction in the movement. In the same way, then after that, first, we did the Tilmash Pottalis Vedana in the second phase, and that has given again a very good response for the development of the muscle strength, the muscular power, and this we were able to achieve in the 4 weeks. So, this was the thing that what I would like to wanted to share, that various kinds of these challenging musculoskeletal cases that what we have treated in our institute with this our Kerala traditional treatment, and with the evidence base, means how we can see that before treatment, after treatment, this documentation we also did it, and so this is just I wanted to share with you. Thank you very much.
Thank you so much. This was absolutely amazing presentation. I would like to open this up to all the attendees. Is there any question for Dr. Mandlecha? Anybody has any questions? It was very well explained. Thank you so much, Dr. Mandlecha, for such wonderful, very, very informative and very valuable presentation. You shared so many practical approaches and treatment options as per the Kerala tradition. And the cases and all those case studies, they're absolutely fascinating. Some of them were so challenging, like cervical dystonia is one of the, very challenging situation. And the other one, which was related to that, young boy related to the
Yeah,
kidney disorder, that
yeah, yeah.
was also very, very fascinating. Yeah, thank you again for sharing your years of experience with everyone. And I'm sure this will be very helpful for everybody.
Yeah, thank you very much for giving this opportunity. Thank you, ma'am. Thank you, Patankar sir, giving me this opportunity to share my experience on this platform. Thank you very much.
Yes, absolutely. Thank you so much, Patankar sir, for in introducing, Dr. Mandlecha. So thank you everyone for attending our webinar, and please watch and subscribe to our YouTube channel. This recording will be available on the YouTube channel so that you can, view it again and again. And please like, comment, and share our videos as well. Once again, I would like to invite you all to become members and also fill out our volunteer form. You can also subscribe to our IU Update newsletter to stay tuned to our projects and events. And if you have any questions, please feel free. You can contact us at Ayurveda Research USA at gmail.com. You can also reach out directly to me. My email ID is asavari@mnayurveda.com. if you have any questions regarding this webinar, or if you are interested into participating in any of our activities. Namaste, Patankar sir.
Namaste. It's my pleasure to introduce all these stalwarts, and I should say diamonds of Maharashtra on this platform. And I am always there to help our own fraternity or faculty to go worldwide by presenting on your platform. So I should say thank you to all, and thank you to Asavari. Thank you. Thank you very much.
Namaste. Thank you, everybody, again. Okay, we'll stay in touch.